gonna come a little bit lower into that spot. Just let the head fall. Okay. Awesome.
Whoa.
Perfect character.
Oh, stripper feet.
She has some stripper feet. I use the word dancer, but this is like what your boyfriend does to you. It's one of them slipping, you got sweaty toes.
I know,
Are you nervous?
all up in my shoes. Oh. Whoa. I didn't even know that existed. Holy
The VMO right here, good, and you're in. Do you feel it?
yeah. It does feel good. It feels good, yeah. Sorry. It's like a car battery getting jumped when you put the things on there.
Yeah, you're like Frankenstein leg.
Oh, whoa, yeah. That one was a little weirder.
More cracks?
More cracks, yeah, a little more pressure. That was the side that was bugging me though, so it definitely worked.
That was a good one. Did okay?
Yeah. This is fun. Wow, I actually haven't felt that much clarity in my sinuses in a long time. Whoa. I feel like I could like do something crazy now.
Do something crazy now. We are here with Aiyana. She is a dancer and an artist, and we did an assessment. She looks really great. She hits all of the range of motions that we need, which makes it harder for me to assess, but we will be doing adjustments. She's got some knee pain that we're gonna look into, and she had a concussion last year. We're gonna use nasal release technique and see if she notices any differences with that. So, do you have anything to say?
Hi.
Cool. So
happy to be here.
Let's go onto your back. We're gonna show off the knee stuff, and then we'll get into those adjustments. So, positive McMurray's test is gonna be pain kind of at this last 30 degrees. It's not crazy for her.
I actually felt that pinch right at the end.
Cool. And then she's got a little tenderness in this gap right here, and in her VMO muscle. So we're gonna get into some dry needles and some laser here. So we're gonna kind of finish with that, but while she's on her back, let's get started with the adjustments. So, when was the last time you got adjusted?
It's been years actually. I used to get this done quite frequently when I was younger and like a teenager. My mom would take me to someone, but it's been a really long time actually.
I wish I had known about chiropractic as a thing when I was younger. Boxing, wrestling, and jiu-jitsu were my sports growing up, and I definitely could have benefited. Real quick, do you feel more of the tightness on this right side compared to the left?
Absolutely. Tight on both sides, but yeah, the right side for sure.
So with assessment, kind of more palpation since we hit all of the ranges of motion. Again, dancers are a little bit harder to adjust because we already have that range there, but we can always get a little bit more. So we'll just stay really relaxed. I'm gonna do a push right here. That's the one. That's good. Let's do it again. So we're gonna come a little bit lower into that spot. Just let the head fall. Okay. Awesome.
Wow, thank you.
Let the camera straight in your face. Awesome. So we're gonna work our way down. We're gonna do a little hug into the spine. I'm gonna have you tuck your chin down just slightly, good, and let all that air out.
Whoa.
Perfect character.
Oh my god.
You got the feet going.
Yeah, happy feet. Got happy feet.
So she also has a little spot in her lower thoracic. So we're gonna do a little bit more of a tuck to open that. And
whoa. Yeah, that was exactly what I was talking about, was that area. Whoa.
We can still needle that if you want.
Sure, I'm down, yeah.
We're throwing everything at her.
Yay.
It's gonna be a long video. Have you had wrist adjusted before?
No, not really. Not.
Okay. These can be a little bit sensitive. Sometimes they're really loud, sometimes they're not. But we're gonna do a little opening here.
Oh.
More.
Really?
We're gonna come back to the faces. Sorry.
Just not used to that. I love
I need
it.
the meta glasses. They're broken right now. I can't get them to turn on. but that way I can film your face while she's getting the
Yeah.
side by side.
I'm sure I'm making some good faces right now.
Cool. And yeah, you're too flexible for me to get tension on the knee. Can we take these guys off? Will they slide off?
Yeah, they'll
Okay.
slide off. I have to tie just a little bit.
Is that okay if I
Yeah.
pull?
Go harder.
When you go into those
so
like
close.
the boot
So
things.
close. There you go. Yeah.
And then let's get the toe pops in for the toe people, or feet people. Dude, our biggest video has like 20 million views on it, and it's just a 6-second clip of me popping toes. It's not a chiropractic thing, but it's for you guys. You know who you are.
Oh, stripper feet.
She has some stripper feet. I use the word dancer, but so, big toe. Cool. This is like what your boyfriend does to you.
Adrian did this to me the other day. I was like, whoa.
Yeah, not the craziest ones. I'm slipping. You got sweaty toes.
I know.
Are you nervous?
All up in my shoes.
All right. Let's get this wrist here. Sometimes. Did you see?
Yeah, I just did that.
Me then, I guess. Taking my job. Sorry, I know these are spicy.
It's okay.
Doing okay?
Yeah.
Made it.
Wow.
While I've got you on your back, have you seen the little towel pull adjustment?
Yeah.
Does that look fun?
Sure. Yeah.
Cool. Make you a little taller.
Just barely. I'll take what I can get.
How tall are you?
I'm 5'1.5 inches.
So usually if we were to measure you before and after, you'll gain like a 1/4 to a 1/2 inch.
Really?
It's not like a permanent thing, but
Yeah.
it's kind of like when you wake up in the morning, your discs are a little bit more fluid in it. Let me alcohol my hands since I just touched your feet. I like starting with the towel. I think it's a little bit more gentle. I'm gonna do a little test pull just to make sure that feels comfy. Your ranges are good. Everything moved really well, so it should go smooth. You'll kind of feel it go down the back. You've seen all the videos. Go ahead and lift the head up real quick and take the hair.
Got a lot of hair, sorry.
Got a lot of hair. I'll lift up one more time. Good. All right, good. Relax there. This is everybody's favorite.
It was kind of scary, but it's okay.
You're in good hands. All right. I like where your hands are at. I got you locked in at the feet.
Yeah, that's funny.
I'm gonna slide you up the table a little bit. Not doing the actual adjustment yet, just sliding you up. Let that head be heavy. Good. Already felt that.
Yeah, that was amazing.
Sweet. I'm just gonna do a little bit more.
Okay, sure.
Cool. Nothing crazy. Good.
Whoa. I didn't even know that existed. Holy shit.
So it adjusts the intervertebral joints. They're a little bit deeper. Any soreness at all right now? You can be honest.
Soreness, not like soreness. I feel that, but like I don't think I'm sore. You know.
Do you feel that kind of go down the spine a little bit?
For sure.
Like
That was like that was like almost in between my shoulder blades.
Perfect.
That's wild. What
that was like
that?
20%. I don't want to crank how they do in the videos on YouTube.
For
on
sure.
day one.
Well, what was that like exactly?
What?
That was like
Cracking?
what happened?
So.
What'd you do to me?
Science. So typically, if you want to come in close, so we have our facet joints guide our motion in the spine. So in our upper cervical spine, it's going to be more of a rotation. As it comes down, it's going to be more lateral bending. So when we're doing the first few adjustments that we did, we're opening up these capsules. They're more superficial, so they're usually louder. On this one, you probably won't hear it on the video, but you heard it inside your head. So sometimes the intervertebral joints, we're pulling at a y-axis motion, and so sometimes it's actually these bigger vertebrae, so it feels a lot more impactful.
Yeah.
Does that kind of make sense?
Yeah, totally. Nooks and crannies, for sure.
Nooks and crannies.
That was the nooks and crannies.
It's like the cleanup crew adjustment. It's like whatever's left, but there is more that we could have done. Sometimes people feel it down the back. This is your day one having it. You haven't been adjusted in a while.
Yeah.
Cool, you're free. Let's go ahead and face me on your side here.
Face this way?
Yes.
Okay. Wow, that's wild. That was so crazy.
Go ahead and look over the camera that way.
Okay, good. Huh?
Yeah, just look over that left shoulder. Say what's up to the fans. She's starting a YouTube channel, so
Yeah.
make sure to follow that. It'll have her art stuff on there. All right, so we're gonna do a little. Sorry.
It's okay.
You okay?
No, it's good.
Let's go up to the side.
Yeah.
Are you a self-adjuster there?
I'm really good at least that turn. Yeah,
Okay.
for sure. I do it almost every morning when I wake
I
up.
can tell.
Yeah.
It's
Oh,
okay.
kitschy.
Yeah, get the star.
Do you ever adjust cats?
I don't. It's like an additional 6 months after your chiropractic school. You can do like equine and dogs.
Whoa.
Their skeletal structure is obviously a little bit different. We're gonna let that leg come down. Cool. Sweet. Let's go ahead. I'm gonna have you flip onto your stomach whenever you're ready. This is clean. Yeah, come in. Come on in.
Baby girl. What up? Yeah, baby boy. My friends.
This is the next video that we're shooting. Sorry to interrupt this. No, it's perfect.
You guys should have
This
just
is
heard
real
what he
life.
did in my neck. That was crazy. The look says it all.
So I'm gonna just give you a little bit of traction, and then we'll get into the knee stuff, and then the nose stuff. She's getting like the whole caboodle. You don't get the pressure. Okay. Trying to make you taller from this way too. This is my favorite thing. A little
Yeah,
bit
this
of
is great.
I try to make Widgie do this to me like every week. He's tired of me. I thought I was like a 3 to 4 week person with how often I get adjusted, and then he's like, "No, you ask me every week to get adjusted." I will take it. Neck still feels good, no soreness. You can be honest.
Yeah, it's like a little I guess maybe feeling a little something there. It doesn't exactly feel sore, but I definitely feel something.
Okay, cool. We'll get back into that. But I'm so self-conscious of my hands now because
Why?
my black fingers.
Oh yeah.
I'm
Like
like-
those just healed, huh?
Yeah, I was doing like a product demo as like the instructor for like what you click on when you receive the product, and my business partner was like, "Dude, you couldn't have waited like a minute, like a week longer before we shot these videos." Because it's like all you can see in the video. It's like the wine, person when they're pouring your glass. All right, let me just check out the hips real quick. Make sure they look good. Too flexible for me to tell. Let's go ahead and flip back onto your back. All right. Let's do your knees. Did these slide up to here?
Yes.
Cool. So far, so good?
Yeah.
Let me slide these guys under. Alright, so Aiyana has not had dry needling before. Are you feeling nervous, excited?
I feel like I get excited for things that scare me a little bit, so
Yeah.
I'm excited.
Cool. That's gonna be really great. So for medial meniscus stuff, MCL, that's kind of what we're looking at is that triad, but she also just has a little muscle tenderness, so I like to use dry needling in combination with lasers. I find that we get this cleared up in like 1 to 2 to 3 sessions versus like a 4 to 6 sessions if we're just doing laser. So it makes me less money, but it gets people better faster. So we're gonna start with that today. Very easy, just 2 needles. It's not like a medical needle, so we're not looking at anything painful when it goes in. What she'll feel is kind of like a dull, achy sensation, and that is a good thing. Maybe the muscles grabbing on a little bit. You might not even feel anything.
Okay,
So
cool.
it shouldn't feel
I
sharp
just
at all.
breathe a lot with needles, so if
Yes.
I'm breathing deep, you're not hurting me. I'm just keeping myself calm.
When you breathe like that, that helps our parasympathetic nervous system, which allows your body to be more open to having a change. So keep doing that. Belly breathing. So we're going into VMO right here. Good. And you're in. Not too bad, huh?
Nope.
This is the nice way to do it. The other way is where I jab you a bunch of times. And it works the same, it's just you hate me afterwards, and we don't want that. Good. Good. All done.
Whoa, I feel that.
So just don't move that leg.
Okay.
I've had somebody kick their leg up to look at it, and it bends the needle inside there. And I'm like, stupid. I hope they're not watching.
I said it, not him.
All right, so this is kind of like the sticky pads with the electricity. She'll feel that stem go through the tip of the needle. It feels good. Feels kind of like a deep muscle massage. So I'm going to slowly start increasing the intensity. It shouldn't be crazy. I want it to be comfortable. And she might get you feeling it? Do you feel it?
Yeah.
Does it feel good?
It does feel good. It feels good, yeah.
Do you want more or less?
I can take a little more.
All right, you tell me then.
Sorry.
It's either like laughter or kind of like tensing up. It's good that you were breathing.
Yeah.
You want a little more?
Sure, yeah.
All right, you tell me
It
more.
feels wild. I feel like it's a a car battery getting jumped when you put the things on
Yeah,
there.
you're like Frankenstein leg.
Yeah, totally.
Just gonna be skipping out of here. So you can't really see it. Sometimes if we have it, is it uncomfortable?
Yeah, no, it feels good.
So sometimes if we can get the intensity high enough, which we want it to be comfortable, you can actually feel the muscle move. We might get some knee extension in there because it's contracting that muscle. For you, I'm gonna slow down that frequency so you can kind of notice that little beat.
Yeah, I feel it.
I think it's a little bit more comfortable at about 20 per second. It feels more like a massage.
Mm-hmm.
Feels good?
Yeah.
Cool. If anything changes, if you want more or less, just let me know. I'm gonna get the laser ready, so gotta switch my glasses. But it is infrared light class 4 laser, so same class as like a tattoo laser removal or laser hair removal or laser incisions. Super souped up, so you will feel a little bit of heat from that. If you feel that heat, that's okay. This company has created a nice little lamp that disperses the heat so we won't burn tissue. If I were doing it handheld, I'd have to keep it moving. Let me get this set up. Videos are always awkward because they just are.
But we look super cool in these glasses.
Yeah, everyone always tries to steal these things.
Mm-hmm.
That is cool. Alright, so that is on. She's got about 3.5 minutes. So we've got the needles not directly on the spot of pain because they're in the VMO, and that's going to attach into the tendons that go into that spot. So our goal is to basically lengthen this spot so she's not getting as much tension there. The laser's directly on the area of pain. That's going to penetrate into that area. So typically with pain, there's inflammation. That's going to decrease the inflammation, getting good energy into the cells. So it's going to speed up the injury process. We use this a lot with our car accident cases, with our athletes that are not able to rest. We always like to start with conservative care first. If it's not clearing up after about 4 to 6 sessions, then we'd look into imaging, MRIs. X-rays won't show us much. MRIs will show us the degree of the injury, and then she can go into an orthopedic surgeon that can make a further decision on surgery or not. We're not going to get there. Usually most people respond really well to exercise, rehab, creating strength in the quads and the hamstrings to basically create natural protection. So even if she has a big tear in there, that doesn't always mean that she needs to get a surgery. We always like to exhaust everything we can do conservatively before pushing into a surgical route. It's me sounding like a doctor.
Dr. Dorsa?
All my buddies are like, sometimes I forget you're a doctor.
I mean, I've never met a doctor that looks like you, so.
That's the goal. So we got about 2 minutes left. How's everything feeling?
Good.
You're not giggling anymore. All used to it.
Yeah, I'm trying to just like breathe through it. I think the sensation at first was just like so. I heard somewhere that like certain pain in the nerves is linked to like the sensation of tickling. Is that true?
Yeah, I mean, there's so much that goes into like the science of how things work. Like if you go into 10 different chiropractic offices with you'll get 10 different explanations of what your pain is, but ultimately at the end of the day, we're doing the same thing. I think what you were maybe alluding to is like where we store our emotions in our body with pain and trauma. Is that kind of what you're talking about?
Well, someone was saying like, when someone tickles you, like the reason why we have that reaction is because it's actually like nerve pain or something. I don't know.
I'm not sure either.
Yeah.
I've heard like if you were tickled as a kid, then you're ticklish, but kids who are not tickled, because it's like a learned behavior.
No way.
I don't know how
I believe
that
you.
is, but you know, people that like aren't ticklish at all.
For
but I think
sure.
you learn that behavior because your parents are like giggling and.
Totally. It's like a mirror neuron thing where you're just like, that's how I.
So that's technically nerves, right? Brain, central nervous system.
Something.
Yeah.
It also just felt, it just felt so funny and like kind of invasive in a good way, you know, or I was like, didn't even know how to react. It was like,
you got like needles, you got lasers.
Yeah, I love it. I really feel the warmth of that laser now.
Yeah, so this is since it's a class 4, it's a ton of energy going in per second. So the class 3B lasers, which are still valid, if you've heard cold laser, it would be the same amount of energy going in. You wouldn't feel anything, but it'd be about a 30 to 40 minute treatment to get the same dosage in. So the heat isn't necessarily like part of, like, it's not the intention, it's just how much energy is going in. There's gonna be heat. But yeah, and then red light therapy, that's just not gonna penetrate enough. That's the stuff you see. You can buy them on Amazon. That's for more like cosmetic type stuff, like superficial layers. So it's science and stuff. All right, you did it. I'm gonna do a little scraping on there. What time are we at, Tia, on that video? And is the microphone still good?
That's wild.
Yeah.
That's cool.
Let me just get a little bit of scraping there. Are you okay with?
Yeah, absolutely.
I can't say that word on YouTube today.
You can't?
Bleep it out. Yeah, it gets like flagged sometimes, and they'll put it as like an 18+ video. I'm like,
what? Really? Trying to keep the medicine from the people.
We're just using a regular old emollient. Yeah, I'm scraping just for any soreness. So after needling, she'll feel a little bit of soreness potentially. It usually just lasts throughout the end of the day. When she wakes up, it'll feel pretty good. Sometimes it could feel worse immediately after because we're traumatizing a traumatized area. But if she drinks a lot of water and she exercises, which she's gonna do after this, get some movement through, that soreness should dissipate. So the adjustments you might feel tomorrow, especially that neck pulling one. I'm gonna skip the taping. You can drop that down and you're in a good position to start the nasal release. Oh, I guess I need new gloves anyways. And I love that you already know how to breathe. A lot of people don't.
It's a simple thing.
I can
for
still hear
some
you.
reason.
I mean, if you want to keep them on.
I felt pretty cool, but I'll take it.
Dude, I've been fucking with these like yellow glasses lately because it like makes everything brighter.
I do think color therapy is like a very real thing.
Do you use like the blue light glasses at night?
I have a red light screen protector. So it's a blue light to red light converter. It's a screen protector I put on my phone. So it like cancels out all the blue light and it makes it all red light, which I've actually noticed a difference with like my ability to sleep quicker, like before bed. And I feel like it's less aggressive on my eyes. Yeah, it seems nice. Seems worth the $40 for sure. Yeah.
All the things we're learning. All right, do you need to blow your nose at all? Cool.
Okay, no.
We're doing nasal release technique. I'll just do a brief little explanation. We're feeding a balloon through these turbinates. It's going to affect palatine bone, sphenoid bone. She'll feel kind of a release, some cracks into her skull. This is going to help with her airway breathing. There's a lot of really great literature on concussion relief as well. So if people get a lot of headaches, sinus headaches especially. Deviated septums, our MMA guys are big fans of this. All of the things. So what I'm gonna have you do is start to just breathe through your belly. I like to put, you already kind of know, And we're just gonna keep that same tempo throughout the same time. Did you ever take a COVID test?
Yes.
Okay,
Yeah.
so kind of gonna feel like that a little
Okay,
bit.
cool.
I already pre-set up the balloon because that's like a 5-minute thing with the dental floss, so we're ready to go. So basically this is gonna pump up. We're just gonna be very light. Excited?
Yeah, excited and nervous.
I'm gonna get you a tissue just in case. Tears sometimes are a thing. Let me drop you back here. All right, she's ready now. Cool. So we're gonna start with that lower passageway. Awesome. And keep breathing. I know. Good job. Perfect. Let's take one big breath in and out through the mouth. Good. With that, did not catch. Sorry.
It's okay.
But you did great.
Okay.
Now we just get to do that again. Perfect, just like last time. Great. There we go. Did you feel a release through there?
I did. I felt this tiny
Like a
little
little
crack.
click?
Yep. Mhm.
Perfect. I'm being very gentle.
Cool. Thank
You got a
you.
little boogie if you want to wipe it. We'll put a sensor on it on the YouTube video.
Yeah, blur that out. Nobody can know I have boogers.
That was pretty easy, yeah?
Yeah, that was
That's
not
okay.
nearly as bad as I thought it would be.
Awesome. So same thing, other side. Good. You got this. Perfect. Sorry. One more breath. Awesome.
Oh, whoa, yeah. That one was a little weirder.
More cracks.
More cracks, yeah, a little more pressure. That was the side that was bugging me though, so it definitely worked. Ooh. Whoa.
If you take a breath right now, that's a little easier.
Way
Sometimes
more.
it'll kick up a little snot, but it'll be nice at the end.
No, I can absolutely breathe deeper.
So we usually have a PNIF machine, which measures your...
A what? Excuse me, sorry. I'm sorry, I don't have to continue.
I always say things on camera and then I'm like, I edit it, I'm like, holy shit. But it measures what volume is going through her nose. And then we'll test afterwards, and we usually get 20 to 30 more units, and that can help us. If we get above 100, you can start doing like mouth taping at night.
Wow.
If you don't have that access, it's unsafe to do that. So this one's gonna be easy, going through the middle part here. You are doing great. I know. Cool. Big breath. And out. Little click. Cool. So this is progressive too. So day one we go pretty light. Then we can add more balloons, more inhales, but
I've never had these sensations before. It's so cool.
it's really weird
Yeah.
when like your skull cracks.
It's cool.
Alright, same thing here. Great. Oh, this is our trouble side. Sorry. Good. Alright, big breath. Good. Okay.
Ooh, yeah.
Clicks.
Yeah, a little tiny one
Cool.
with that one.
That's what we're looking for. We're gonna hit the sphenoid bone on this last one. So you'll feel it I'm gonna kinda hit the roof of your nose.
Uh-huh.
And then that's how you know we're in that upper portion. Yeah, great, you need another tissue?
Uh-uh.
Cool. Alright. 2 more. This is almost there. Good, sorry, I know. There we go. 1 more. That was a good one. Did okay?
Yeah.
Alright.
This is
Did you feel
fun.
releases there? Did you feel releases on that one?
Yeah.
I'm being nice.
Thank
but
you.
They can be crazy.
Yeah.
You're not crying, so we're doing okay.
It's okay, we just started to get to know each other.
Perfect. Last one, big breath.
Whoa.
Yep.
Bizarre.
I think that's a new one. I like starting to like write down people's like reactions after doing this, but I don't think it's a simple word, but I don't think I've gotten it
It's
before.
just bizarre. I've never felt that before.
You did it. You want to continue the issue?
Sure, thank you. Wow. That was wild.
We did a lot of stuff in this session, a lot of new things.
Yeah, thank you so much.
How do you feel? You're already feeling
Feel
pretty good coming in here.
Great, yeah. Feel better though. I feel super like open.
Yeah.
If that makes sense.
Get some breath work in tonight. If that's something that
cool.
you practice.
I do. Wow, I actually haven't felt that much clarity in my sinuses in a long time.
A lot of times you don't realize like what is off. Like that's what I like about chiropractic. Even if you're feeling good, like seeing if maybe you can feel better from that. So.
Wow, yeah, there's been a lot of like this left side of my face specifically. I've been having a lot of just inability to like take a full.
Yeah, I didn't have you doing any like pre-post tests. Sorry, we're kind of in a rush with that battery. Is that battery still
It's all good.
alive?
Last couple of days even I've been trying to do, because when I do breath work sometimes I'll like close one nostril and just breathe through one side and like switch them off, and this one's been funky for a minute. So
Test that out. Get a little subjective measure since we couldn't get the objective. All right, let's come on up. If you want to toss that right there. Swing the legs around. Let's get a little shoulder crack to finish it off. I'm gonna come around through here and we're gonna pull up. And we're gonna try this side too. Sometimes they're crazy, sometimes they're little baby ones. So awesome. How are we feeling?
amazing.
New woman?
Yeah, new woman actually. I feel like I'm glowing now.
Yeah.
Yeah, that was awesome. Thank you so much.
Sweet.
Yeah. Whoa. I feel like I could like do something crazy now.
Do something crazy now.
Do something crazy.
So, I'm gonna put up your fire spinning stuff that you did this year. I'll put that like in a little side clip. She does like crazy fire spinning stuff.
Light stuff on fire.
Yay!
Wow.
All right.
Oh my god, that was great. Thank you so much. Wow, that was awesome.
I'll get the real high five. I have
Yeah.
to high five myself before.
Sheesh. Whoa. Grateful.
Holy shit. Wow.
That's good?
Yeah, I feel like all that, this like energy just got like, and now I just need to like shake or something. Like,
Daniel, how was that?
I mean, it wasn't comfortable, but it was like dope. Like, I love trying things I haven't tried. It felt really good. I now feel like my face is so open and like,
I'll try it.
fuck it.
The lighters
Fuck it.
start floating away somewhere.
Yeah, no, totally. I feel like I'm vibing.
Yeah, your face didn't show. I know that people on camera, like, it was so funny when I did that.
Massive, I remember.
What was it doing inside the nose?
So it just blows up and it shifts. Yeah.
Oh, interesting.
So it don't feel like.
Good, how are you? A big chonker bonkers.
I was gonna say, there's a
Oh,
chalky
did you?
monkey. Where's those at Sturgis on?
I did. They're so well broken.